last scope was clear. Your calprotectin is normal. Your GI said that you're doing great. And your skeleton is quietly losing density right now, and nobody has told you to check. Hi, I'm Kate, and today we're talking about bone density loss in Crohn's disease, and it matters right now because the bone loss is happening silently. It's happening even in remission, and the window to do something meaningful about it is open, but it doesn't stay open forever. After my husband's third surgery, the moment we realized we hadn't discussed or the, safety of his bones hadn't been on anyone's radar. Cumulative steroid courses across his Crohn's, we couldn't even remember what that number was because it was a lot. And when my son went into remission, I did have a quiet worry underneath the good news, but I was tracking his vitamin D levels and the clinic wasn't. So here's what the research actually shows. People with Crohn's disease have somewhere between 2 and 4 times the fracture risk of the general public. Even when your Crohn's goes quiet, the risk, it doesn't disappear. A 2023 systemic review confirmed that systemic inflammation alone, even low grade, even subclinical, drives bone resorption independently of steroid use. That means the 3 mechanisms working against your skeleton are steroid exposure, nutrient malabsorption, and inflammation itself, and all 3 can be running simultaneously while your scope looks fine. So this is not about alarm, it's about knowing what to measure and what to do with that number. So the plan. Understand the 3-way mechanism: steroids, malabsorption, and systemic inflammation. Well, they each attack their bones through a different pathway. And in Crohn's, all 3 often stack on top of each other. Again, Crohn's people are so lucky. So you need to know what a DEXA scan tells you. Tell your doctor you want a T-score and a Z-score because they're not the same number. And for Crohn's patients, the Z-score is the one that matters most. The patient who came in relieved because her T-score looked not that bad, we then had to explain about the Z-score, which did not look that great. Another thing to make sure is to have the right calcium. Calcium carbonate versus calcium citrate. The absorption difference is clinically significant for anyone with gut inflammation or low stomach acid. So make sure you switch to calcium citrate. Dose timing matters as much as the dose itself. Vitamin D is not optional, and the standard dose is probably wrong. The generic 1000 IU recommendation was not built for people with fat malabsorption. Crohn's patients often need significantly higher doses, but the only safe way to know is to test serum 25-OHD and then retest it after 12 weeks. My son's baseline vitamin D result at diagnosis, wasn't great. We then went on some vitamin D, had it tested, and he's in the safe range now, so we don't take a supplement anymore, but we test regularly. The other important thing to do is make sure you're doing weight-bearing movement that actually loads bones. So swimming and cycling are great for your joints, but they don't produce a mechanical load that tells osteoblasts to build, and the specific movement types that do are achievable even during a partial flare. Make sure you get some help if you're going to the gym. Ask the trainer, what can I be doing that's going to actually help prevent osteoporosis? So my husband is 20 years flare-free. His bone picture looks pretty good now versus what it could have looked like if we had not thought about this. The realistic, honest picture, you can't undo what's happened, but you can change the trajectory from here. So it felt much better as a mum to hand my son a protocol rather than me just freaking out and worrying myself. So the practical action is the antidote to just the fear. So if you take one thing from today, let it be this. Ask your GI for a DEXA scan and ask specifically for your Z-score. That single number is your starting point. Remember, this is not a substitute for your GI's advice. It is the conversation you bring to that appointment. I'll see you in the next video. Have a beautiful day.